So, starting us off with our main event, I'm going to turn the session over to our trainers, Jamie Comstock and Robin Carr, who together are Info Inspired, and they're going to share just a little bit more about themselves before they move into a really great session. Thank you all. Thanks, Jamie.
Thanks, Claire. Hi, good morning. It still is morning. My name is Jamie Comstock, and this is my partner in crime, Robin Carr.
Good morning.
And we just first wanted to thank the New Jersey Governor's Council on Substance Use Disorder and the Rutgers University Center for School of Social Work and Center for Prevention Science for inviting us to be here today. We are really delighted. We're going to be here together for about an hour, and Robin and I are going to alternate back and forth, so you will hear from both of us. This session, as Claire mentioned, is also being recorded, so you can sit back, relax. You can come back to it if you need it. You will receive a copy of the slide deck, and the last slide has a list, a bunch of resources for you to refer to and work from later as you have time and ability. So a little bit about Robin and I. We have both been working in prevention for almost 20 years each. If you round it up, I think you would hit 20 years each for sure. And we hold advanced prevention specialist certifications. So we've been doing this work a long time. We started working together in the same building in 2012. And when we started doing that work together, we realized pretty quickly that the communications we were having with our community partners weren't having the impact we wanted them to have. And that was an issue for us, a real problem, because in prevention, we work in collaboration with community partners, and we were having trouble really kind of communicating the importance of the work that we do and in our mission. And we knew that we needed to correct this like really quickly if we wanted to have the impact that we definitely do want to have in the work that we do. So Robin and I are pretty avid DIYers, and we live in Maine where you can fix anything with duct tape and twist ties. And so we just set about like solving this problem for ourselves. And we worked nights and weekends and really just trying to figure out sort of best practices around communications and soft skills, and ended up developing some processes and some systems for ourselves, and then putting those processes and systems into place. And when we started using those, we began to see success, and people that we worked with throughout the state saw that and asked us to help them communicate the same way also. And so we started training people in 2018, and we have trained thousands of prevention people across the United States. Also, folks who work in kind of those allied professions like recovery and treatment, and also people who work in what we call helping professions. And those are real mission driven folks who often if you need anything done, that's who you want to give the project to, are those kinds of people who work in mission-driven professions, who have that drive and that commitment. Yet we also tend to have a lack of training in those areas, in some of these professions, and definitely kind of communications and soft skills. So we've been doing this for quite a while. Let's see. We work in prevention as our day job, Robin and I. And this training is a combination of all of the training that we've had over the years. So what we've been taught to do, and then our experience in actually doing the work. So it's that place where what we've been taught to do actually translates into the field. So, in today's session, we are going to cover these 5 steps that you see before you. And essentially, they are a jargon free layperson's version of a process we use in prevention called the Strategic Prevention Framework. And sometimes we abbreviate that to SPF or SPIF. And if you work in prevention, you will likely hear that as time goes on. Hopefully, it's the last time you'll hear us say that today in this session because it is a bit jargony. Um, but this process is really just a logical, rational process that we apply to prevention work. And it's much like any other logical, rational process you would apply in any problem solving that you engage in, including getting your garden ready. And we're going to use the garden as our helpful metaphor today. So, today we're also going to talk about ways we can create impact when we don't have the time or the money to do it all. And that I was thinking, reflecting, that's most of the time. And how to apply prevention science in real life, not just in theory. All right. So, the first step in our process is really understanding the issues. And in garden speak, this is like really understanding and assessing the conditions that will impact our garden. So, are there rocks in the soil? How much sun is there? How much room do I have? Where's the water source? All those kind of questions to help us understand uh, how best to make this garden prosper. In prevention, this step is about really understanding the conditions in your community that impact or are impacted by substance use. So in 2007, I was hired to create a prevention plan using the very same process that we're talking about right now. And I was hired to do that for 2 counties, and they were giant counties. You could fit like some New England states into these counties. And I was also pretty new to the state of Maine, and I didn't have a lot of connections. But the connections that I did have, they knew experts in these 2 counties who had firsthand experience with both youth and with substance use disorder. And they connected me with these people. And I just set about talking to these folks to figure out what they were seeing in their communities. And the types of people I talked to were, it was such a range: principals, teachers, school counselors, parents, youth, law enforcement, folks who worked at the Y, at the Boys and Girls Club, different community organizations, the district attorney's office, local businesses, public health people, higher education, municipal leaders. It was a huge, broad attempt to really understand what was going on in the community. And I asked every single one of them, can you tell me the story of substance use in your community? What are you seeing in your community? How are young people impacted? What has changed over time? Because a lot has changed over time. What's been successful? What's in place to keep kids connected? What prevents them, in your opinion, from using substances? And as I was talking to all of these people, I was starting to wonder, like, how many people is enough people? When do I know when I have done my job in this part of the work? And when I was in grad school, I remember writing a paper about something. I don't remember what anymore, but um, part of the paper was a literature review. And I remember asking my professor, like, how do I know when I've researched enough, when I have done enough of that lit review piece? And the response back was that I would know as soon as the themes started to repeat themselves. And so in my case, I knew that I was done talking with people for this piece of the process. as soon as I had adequately covered my geography, because there were two big, diverse counties, and then when those themes started repeating, and I ended up talking with about 50 people. And there's no magic number to that. You'll know the number of people that is correct with you based on the size of your area and when those themes start repeating. The other piece of really understanding what's going on in your community will come from looking at data. And data can help you really understand some of those things that people told you about your community. You can find data in lots and lots of places. And in your handout packet, we have included a sheet that is an example cannabis assessment that we did. And what you'll see there is a mixture of business sources and government sources and health surveys. So you could pull together something very similar for any topic that you identify in your work. Robin and I tend to lean a whole bunch on our youth state survey and also data from the federal government. And we've linked all these resources for you on the last slide so you can take a look at those at your leisure. And the goal here, like I mentioned, is to really tell a story of what's happening in your community using both words and numbers. So the qualitative and the quantitative. One little bit of a trick that we use a lot is pairing qualitative data with quantitative data when we're trying to describe what's going on in our communities. And we've found that when you do pair those together, it really kind of amplifies and strengthen each of those individual statements. So, for example, if you might find in your school survey that 40% of middle schoolers have tried vaping. And then you remember that one of your middle school principals said that vaping related suspensions have increased 50%. So, alone, those statements aren't as powerful as they are together when they reinforce each other and are paired together. So, two last quick points here. Understand that when you're talking to people, um, the antidotes that they share with you are just anecdotes. They're not data. So, one person's perspective is just that. It's one part of the story, not the whole story. And that's why the goal is to get as many people get the input and the perspectives from as many people as you can, and also know that this step can take as much time as you give it. Assessment can take 2 years or 2 months or 2 days even, and it's easy to fall into that analysis paralysis stage. So just keep it simple. We just simply want to talk with some people, identify some key themes, and look at some numbers. All right. So our next step is growing relationships and gathering resources to do the work. And the first piece of that is building our prevention team. In prevention, we like to assemble a diverse set of team members. And the idea is that each one of those team members holds a unique perspective when looking at at the issues in your community. And together, they form like kind of a 3D view of the issues in your community. So if every one of those people had the viewpoint of a hammer, the issue would be a nail. Like the problem you would be trying to be solving is a nail. But when you have all of them together, you have a really comprehensive understanding of what the issues are, things that you may have never thought of before. And then when you would ask those same folks with those same perspectives to generate solutions to that issue, you end up with a really rich and robust set of solutions to your issue. So in my case, my team members really ended up being people that I'd talked to in that first assessment step, and some of those people, as I was talking to them, I thought, wow, they'd be a really great fit for this team. And so I asked them if they wanted to participate. Others asked me if they could participate. Some folks said, I don't really have time or the interest in serving on something long term, but you know what? If you have a task force or a subcommittee, I'd be really happy to do that. Other people said, you know what? I don't really want to serve on a subcommittee, but I'm a photographer on the side and I would love to take pictures and then give them to you to use as you see fit. Or I like to build websites. I'd be happy to help you build yours. One of the cool things about this part of the process is like you're taking all these gifts that people are just giving you and you're figuring out how to assemble them in a way that like a jigsaw puzzle. And you're creating that as you go along. It's very organic and really awesome. Um, Robin and I have also learned that the best partnerships happen when we can identify shared common goals and priorities so that working together is mutually beneficial. And sometimes an unlikely partner might be just the partner you need, so you never really know. And an example of that might be that a member of a local environmental group might have a passion for eliminating vape waste, and you've seen that on your sidewalks, and there's really no good solution, but they are passionate about eliminating vape waste. And your group, your prevention group, has decided that they want to address youth vaping. And so, even though if you address youth vaping, you're actually addressing vape waste because you would be reducing that. And so there's an intersection of interest here, and working together might help both parties achieve their goals. So, in this part of the process, we also know that your team members might have varying interest and ability to participate, and they also may have, well, they definitely will bring varying levels of knowledge and perspectives about the issues that you're addressing. And this might be a really great time to provide them some training. And the Northeast and Caribbean Prevention Technology Transfer Center and other webinars that have been created or developed or shown to you through the Municipal Alliance effort, those can be a great resource for your prevention training needs also. And they provide a wonderful opportunity to develop a common foundation for your team as they move through this process, and also some common language for people. We've linked some of those training resources on the resource slide also. Um, this is also time to identify different resources um, that you have and resources that you might need during this process. Um, Things you might ask yourself are, what programs are in place in my community that I can leverage? What are potential funding sources? Do you need volunteers? Where can you find them? Are there places or events or meetings where people already are coming together that you can build into? When I started my job all those years ago, I remember thinking, I'm gonna have this meeting and people are gonna come, and I'm gonna have this event and people are gonna come, and sometimes they did, and sometimes they didn't. And over time, what I learned was that it's far better to partner with someone and to build into something that already exists, because you can guarantee that the impact will be bigger. So some things that we do very regularly are partner with schools for different parents' nights or step up nights, or different events that people might be having, maybe at the Y, or a village fair that a municipality is going to have. Those are some quick kind of wins that you can build into. And then the final part of this step is raising community awareness and excitement about your efforts and talking about the work you're doing with new people and with your existing networks and asking your team members to do the same. This is the space where you could, write short articles to put in a newsletter and do some social media posts. And then keep in mind that the data that you identified in the first step is a really great tool for increasing awareness about prevention issues and engaging additional stakeholders and also mobilizing the resources you need to support your prevention efforts.
So we're going to move into the next step now. And this is when we've got some ingredients to work with and are beginning to think about what our plan will look like, maybe our plan for the year. And for me, I know that when I'm in the first initial phases, when I'm talking to people, when I'm looking at the data, two things are happening for me at the same time. One is I'm getting excited about the possibilities of things I could do. And then also it starts to feel really overwhelming fast because some of the issues that we identify are big. We almost always don't have enough resources dedicated to do anything about it and do really solve it within a short period of time, and neither do our partners. And so really, first and foremost, what Jamie and I want to convey is we want to think about ways in which we can make a meaningful contribution to this work. And really, that's what we've been doing throughout the course of time. We've been working on substance use prevention over the years. We haven't solved anything in a year, but incrementally, each year, working together, all of our contributions certainly are making a positive impact. And so just keep that in mind as you go forward and you're putting your plan together. In preparation for doing this training, I went back and looked at some of my first plans I put together for substance use prevention when I started doing this work and working with Jamie at the city. And they look really good, and they are really good on paper, and they were completely undoable in real life. And I had a tough first few years, a really steep learning curve, really realizing that the best plans, the most effective plans are realistic plans. And the ones that take into consideration whether you have 1 hour a week to do this work or a full-time staff person or anything in between, like really being realistic about what that is and how can I take what I have, both the community energy and resources, my time, the funding, and how do I take that to make the most meaningful contribution I can this year. So I'll give you an example of that. So as we said, we live in Maine and we have legal adult use cannabis and retail stores and legal medical cannabis use. So there's a lot of access to cannabis. We have some pretty prevalent positive attitudes about its use and some higher rates across all age groups in our state than other parts of the country. And there are a lot of areas in which we could decide to focus. And as we think about focusing our issues, again, back in the beginning, when I look at my old plans from back in the day that make me like embarrassed a little bit, it would say reduce cannabis use. And that's really big, just even of itself, if you're thinking about identifying a key focus area. And so this year, something that we're working on, what we're identifying as something that we can make a meaningful contribution on, is working with healthcare providers to increase their tools and ability to have conversations with their patients and about cannabis. And in addition to this being something that's a need, the real reasons that we're working on it this year are because we had a healthcare provider who approached us. She was working on a school project because she was in a master's program. She wanted to do something with cannabis and thought healthcare providers might be a good idea. She thought that perhaps they could use some tools and assistance to have conversations because these are hard conversations to have. And so we were like, yeah, that would be awesome. And so the first thing that she did was develop a survey, and she put that out to all the healthcare providers in our area. And amazingly, she got 14 responses from physicians which getting 14 physicians in our community to take the time to respond was awesome. And we have insights into their needs and interests and experiences that we've never had before. We have somebody that is interested in working with us on this, who's from the healthcare community, who speaks healthcare, who has credibility, who can make connections. And so we're using that to work together to develop this toolkit that's based on what the healthcare providers said they needed and they were interested in knowing. It didn't totally align with what we thought, even when we were thinking about doing this, like what we thought they said they needed. No, they kind of said some different stuff. And so we're taking their lead. We're working with our healthcare provider on her project and continuing that on through the year. And no, I don't expect that we're going to see a reduction in cannabis use for any age group that we're probably going to be able to measure in our state survey this year, maybe the next year. But what I do think we'll be able to do with this is to increase the number of conversations that patients and physicians are having with each other about cannabis use, increase the amount of science-based information people get to make their decisions. And in turn, again, that contribution leading to the place that we want to go. So I talked a little bit about thinking about making the contribution, where you might want to focus in on, and told you a magic story. It happens to be real in this case, this magic story of everything came together and it seems like, oh yeah, this is what we're going to work on this year. That almost never happens. And that's okay if it doesn't, because in the times that it doesn't and you aren't completely led in the right direction, there's a lot of resources out there for you to get your bearings and figure out, all right, what am I going to work on? What have I got the tools for? What have I got the time for? What does the science say works to do for this particular issue? So again, some of them are linked in the resources slide within this presentation, and starting with the Municipal Alliance resources and also some Substance Abuse Mental Health Services Administration resources and other places you can go to find activities and strategies that are science-based, known to be effective for whatever it is you might want to work on. So sometimes you might know, like, oh, here's our issue. People are kind of interested in working on this. I'm not really sure what programs or initiatives are out there that the science says works, but you start to find some of them. And then the other key piece here with the effective plan is to check that back with the people in your town, in your community, to make sure, like, you might think something is a really good idea. That's the other thing I didn't tell you about my plans from the early days, is that there were a lot of things that I thought were a really good idea that nobody else did. And those were stinkers. Those are losers. So we want to make sure that whatever we think about doing, so hey, maybe I think a parent education program would be great, and I find this one, I go back to my community and say, hey, I found this great parent education program. Parents, would you want to do this? And like, who should do it? And who would you like to teach it? And how could it work? And what do you need? And they might tell you, yeah, that's great, and let's do it, and this is how we need to do it. Or they might say, I don't think parents want to do that at all. Or parents might like to do it, but we don't have the time. So these plans have to really center around the community needs, their values. They have to be really at the heart of it in order for them to work. We want them to see themselves in everything they're doing. And that really begins with their involvement every step of the way in making this plan and carrying it out. We wanted to give you one more tool as you're thinking about putting together your plan. Sometimes I have thoughts about what we might do for the year, but I can't quite figure out what's realistic, how it's all going to happen. And so I really like this grid. If you're not familiar with it, it's a good tool to have in your back pocket, especially if you're doing some planning with your community and other people, because you can kind of work together to see this makes sense, this doesn't make sense, we've got time for this, we don't have time for that. So on the upper left-hand corner, what you're looking, and this grid talks about your effort and your impact. And so what you see here is up on the upper left corner, you have your quick win area. This is the stuff that you get high impact from doing little effort. And for our garden metaphor and for where we live in the Northeast, that would be like growing cucumbers or zucchinis. Just put them in the ground, They pretty much grow. I can grow them. That should tell you something. And we don't have to do a lot, and it just happens. In the prevention world, for me, those quick wins this year have been things like we bought some locking bags to hand out at community events to get people to store cannabis in their home, so more safely store cannabis in their homes so that youth weren't able to get exposed to those in homes. We also worked with some cannabis retailers who were happy to give those out to people who are coming in to make purchases. I did have to have a little funding to make that happen, but in terms of actually executing it, it was pretty low key. And people seemed all on board with it. People want to have the bags in our community. And so there we go. There was a quick win for us. So I know that I can go back to that. The big projects are what are on the upper right-hand corner. And they're your high effort stuff, but it's the stuff that is really going to give you the biggest bang for your buck. And I think policy when it comes to prevention, that's the big project stuff. And let's say you figure out that there are, there's a lot of youth vaping in the community. The school really wants to work on doing something differently for the students. And everyone's on board with potentially doing a policy change. Maybe they're suspending students out of a school for policy violations, but they want to do something different. They want to keep kids in school. They want to provide them with a treatment program. That would be amazing. And even if everybody's on board, it's going to take probably a year, if not longer, to implement that policy. Any policy work, any systems work that we do, it takes a while. And it's really worthy work, but it's just good to know to keep that in mind, like how many big projects, is this my big project here? Are the stars aligning for that? And if so, keeping perspective about the other things that might go on. The low effort, low impact stuff is in the bottom left box. Those are your fill-ins. So prevention work that for me is going out to a community event and having a table, and which I love doing and I think is important to do, and getting to talk to people and share some resources and spending my day doing that. It's great, and if it's something that I'm running out of time, I won't necessarily do, because those events, while they're wonderful and they can be helpful, they won't necessarily translate into a really big contribution at the end of my year. But it's the stuff I know if I can, I'm going to try to fit it in. Those are my fill-in things. And on the bottom right, we have our thankless tasks. And in prevention, I think we all know what they are. We got a lot of those thankless tasks. Some of them we choose, some of them we don't choose. They take a lot of effort, and they have pretty low impact. For thinking about our garden metaphor, that would be like us in Maine trying to grow an avocado or a pineapple. It's a lot of work, and it's probably not going to translate into much. For a prevention example, I would say it would be something like, all right, I decide I'm going to create a series of trifold brochures for high school students to tell them about the dangers of different substances. That would probably take a lot of my time to put something like that together. And I'm also guessing it's something that wouldn't be very helpful to any of those teams. So how I would use this grid, how I've used it with a group and it's worked really well, is for every potential activity or strategy that might be on your list, I would write each one of them down on a sticky note, and I probably have this grid up on a flip chart on the wall. And then you can kind of talk through these together and say, all right, is this a quick win? Is this a big project? Or where does this go? And then that will help you sort of put together this scheme of, yeah, we're going to do this. No, we're not going to do that. This is how much time we're going to spend here. And everybody's on board with it and kind of gets the meaning and understanding behind doing that.
All right, so you have planned your garden. You know where you're going to put it, you know how big it's going to be, what you're going to plant. You have a plan for all the maintenance of the garden. And now it's time to plant that. And similarly, we're gonna put our prevention plan now into action by implementing all those programs and practices that we identified in the plan. So, something that you will no doubt need to consider is this idea of exactness and flexibility. You may know it as fidelity versus adaptation, and the idea is that when we evidence-based programs are created and studied in a setting, and the belief is that when you want to replicate or implement a similar project in a different setting, that the closest to the original design you can get, you will have better outcomes. But we all know that the communities we work in are incredibly unique and they often require some level of flexibility. So, I was thinking about that parent program that Robin was talking about, and do parents even want to do it? And say they do, and say that I want to implement that program, and it happened to have been developed in an urban area, maybe at a like a public housing location or something where parents were on site in a community resource room. But I loved the idea of it, and I wanted to implement it in a rural environment where we know um, usually transportation is a barrier. So there might be could be literacy differences, um, and it may not fit exactly in that rural area where I want to do it, and I might need to tweak it. And so, what is great, before I remember back along, the researchers would say, you can't actually do that because the locations are too different. The populations are too different. And now we are actually beginning to understand the importance of this middle ground of being able to adjust programs and have flexibility, and we know that you can actually achieve some really good outcomes even with those minor tweaks and adjustments. And so in the resource slide, there is a link to a handout that will help kind of walk you through a better understanding of this concept of exactness and flexibility. And it will give you examples of some fairly common adaptations. Use this as a reference if this is part of what you are going to be looking at. Some of the most common adaptations are things around language and translation and modifying vocabulary, and then replacing images or cultural references to better reflect the community that you're going to be implementing it in. Those kinds of things tend not to impact the outcomes too much. Things that do impact outcomes are when you reduce the number of sessions or the length of sessions or how long the participants are involved. So, say it was an 18-month program and you wanted to only implement it for 12 months. Eliminating some of the key messages or topics that you cover. Those are also things that we know have a higher likelihood of impacting outcomes. So you can look again at that handout and figure out what, if any, adaptations need to be made. And I kind of think of this as using the garden metaphor. It's probably okay to plant the plants a little bit closer than the seed packet says. You're probably still going to get like some good, cucumbers, a good number of cucumbers. But if you plant a plant that needs partial shade in full sun, it might actually hurt your outcomes and your garden yield. Another important piece of this is that you're going to want to have a continuous quality improvement plan to keep an eye on how the program is progressing as it unfolds with the changes you made, and you might need to tweak it a little as you move along. The last part the last step of our process is evaluation. And that, like, how did your garden grow? What did you get? Was it yummy? Um, there are a couple of components to this step, and the first is the outcome evaluation, and that looks at results. It's kind of the micro. Did the program or the practice that you implemented, did it make a difference? And if so, what did change? Um, Usually the population is measured, did the population gain knowledge that we wanted them to? Did their attitudes change? Did they get the skills we wanted them to get? Both in the short and in the long term. So that's one piece of it, really measuring those programs and policies that you implemented. And then the second part of the evaluation is the process evaluation. And the process evaluation is about those 5 steps that we've been talking about. This process is designed to continue to flow right from evaluation back into assessment and keep going. So what we want to know in our process evaluation is, did we do what we said we were going to do? Were the programs and the policies and the practices implemented as we planned for them to be? Did we make adaptations? What were they? How did that work out? Did we have enough resources? Did we need more? What obstacles did we encounter? And you need both of those, the micro and the macro, as you figure out how this process worked for you. You might not decide to implement the same program next year. Those parents may not be interested in doing that at all. And then as you move through, you also are going to be making mid-course corrections. Robin and I attended a conference a few weeks ago, and the speaker was from a harm reduction organization, and she was talking about a program they were implementing, and it was the idea was to get people who use drugs signed up for a text distribution list, so that if something came up more dangerous than normal in the drug supply, this organization could just send a quick text message and let people know, hey, something's up, be careful. And their idea was to make out these little cards with a QR code on them, and outreach workers would hand the cards out to people. The potential participants would, scan the QR code. It would take them to a web page. They would fill out all their information, hit, submit, and then they would be on the list. What the organization discovered was that it wasn't working like that at all. People weren't signing up. Not the numbers that they anticipated. It wasn't happening as quickly as anticipated. And so they made a mid-course correction. They called in the outreach workers. They said, hey, this is not working. Do you think it would be possible for you to just sign people up out in the field if they give you permission? The outreach workers said yes. And so at that point where she was presenting at this conference, they had just started making this change where the outreach workers were directly signing people up. So this is the last stage, your evaluation. You're on mute.
Hey, thanks.
Yeah.
No doubt. We are talking with preventionists who have made changes, who have had effective programs and interventions, and ones that are lasting. And that's obviously our gold standard here, making changes that last in our community. And how do you do that? And what are the hallmarks of it? And so we want to share some of those indicators for us, wonder if they ring true for you. Certainly thinking about policies are one change that you could put into place that has the potential to last. That's like the planting trees, perennial sort of thing that we're going for. And what we'd also submit is like planting them under the best conditions. So it isn't just about a policy, it's about a policy at a school that the teachers really believe in, that the administration is on board with, that the parents are good with, the students are following. And that, to me, when those things are coming together, tell me this is something that when I go back in a few years, that policy won't just be something that's written on a piece of paper. It will be what people are doing in practice. And that's what I try to wait for when I'm doing my work. Jamie and I were doing a training the other day, and she asked a question in the beginning, what's one thing you want to accomplish in your lifetime? And one of the preventionists typed in the chat, I want to pass a policy. And I just felt her so hard because that's the best stuff. And we do it, we definitely do it. And it really, it's one of those amazing lasting changes that we can do with our work. Then we have these things that we have to do, and we have to keep doing them. I'm going to keep planting cucumbers every year because they're delicious and we need them and we eat a ton of them. And you need me to plant them. They're not going to get planted on their own. And making those types of changes that last, keeping us doing our work, we believe a lot of it is about sharing the news of the good stuff that we're doing this program. Who did it impact? People's stories and experiences of the success of the work that we're doing, and sharing that so other people who don't do this work and aren't in this field understand the value of it and want to keep funding it, and maybe even want to give it more money because these preventionists are so important in our community. So if we can figure out ways to sort of automate that in the way that we do our other prevention work, we're doing good stuff. All right, I got to tell people about this now, and it has to be a very regular part of the work that I do, and we have to do it in ways that are easy for people to understand. Also, it's just a part of it. It needs to be a part of it, and it helps us tremendously when we take the time to do that stuff and we talk with our community about the work that we're doing. Lastly, we've mentioned this a few times, the investment of our partners in the community, and that being a key indicator of making a change that will last. I think back to when we started doing Drug Take Back Day in the state of Maine, we had really high rates of prescription drug diversion in the community, and we have the oldest state in the nation, so there are a lot of medications that are just out there, and high rates of chronic disease. And from the very beginning, I could tell that this was going to be an initiative that would last. And one reason was because there were these other partners that were incredibly invested in it, and really even more so than we were at our local prevention level. So we had the federal DEA who was putting this out, and then our local law enforcement partners in our towns were so excited about it because they had, number one, the opportunity to do something proactive in the community about a problem that they were seeing. They want to help. And also it was a great way for them to do it in a public way too, where they got to interact with the community in a really positive way, which they like as much as we do. And so the first couple take back days, I got all ready to do all these things, and they didn't even need me to do them because they were already doing them themselves. And I might have put something in the paper and shown up that morning to just hold the box. I don't even remember what it was, but they didn't really need me. And this is something that's still going on and tremendously successful in our communities today. And it's because those other partners wanted it and were invested in it and see the value in it. And whenever we can make that happen, from the beginning of when we're talking to people efforts all the way up until the end, it's just going to keep setting the stage for these things that we can put into place that are going to stand the test of time. As we're wrapping up here, this is the resource slide that we were talking about. And what you'll find, all of these sources are hyperlinked, and it's not a comprehensive list. We wanted to give you a starting point. And the things that are here are places where you can go to get data. They are places you could go to get lists of interventions and activities that you can use in your community. There are a couple of different examples of ways you can do local assessment sort of things and picking out strategies, and places you can go to find training and toolkits and other forms of technical assistance to get you started, because we know that you'll need different things along the way. We wanted to also once again thank the New Jersey Governor's Council on Substance Use Disorder Municipal Alliance and the Rutgers University School of Social Work Center for Prevention Science for bringing us together. But mostly, we want to thank all of you who are doing this prevention work, who are with us today, or who are going to watch this in the future. And we thank you for doing the work alongside us, and keep going.